10 o'clock. Let's get started. Good morning and welcome to today's webinar on ambulatory surgery centers. This is our 11th and final episode in our Improving Employee Health and the Bottom Line series. So standard housekeeping notes, everybody is on mute. We are recording today's presentation. Later today, you will get a copy of both the recording and the slide deck. If you have questions, just wiggle your mouse around on your screen. A little box should pop up. It's either the top or the bottom. There's a little Q&A box there. Type your questions in and we will do our best to get to them at the end of the presentation. If we run out of time, we will email you a response. So with us today is Jamie Fowler of Pacific Surgery Center. She's going to help us better understand how ambulatory surgery centers help patients to achieve better health outcomes while simultaneously helping employers to keep their claims costs to a minimum. Jamie, thank you for joining us today.
No problem, Heather.
We're excited to learn more. It is all yours.
All righty, thank you. So my plan for today's presentation is to go over what an ASC or an ambulatory surgery center is and how cost savings can be captured through the utilization of them. Just a brief introduction, I've been in the industry for over 18 years, and through that time I've definitely seen many changes and developments of the ASC in the healthcare industry. So I just wanted to quickly share with you some of that information. Okay, so as far as outpatient surgical services go, there are two main categories for surgical care. There are hospital outpatient departments, which are known as HOPDs. These facilities are hospital owned. And then the other one is an ambulatory surgery center, such as also known as ASCs. And with ASCs, there can be many different types of ownership structures. One of those commonly is, which is about 65%, they are wholly owned by physicians and operate as small businesses. The other type are centers that are partially owned, either a majority or a minority by physicians, often in conjunction with hospitals and or management companies. So just to give a little bit of history of surgery centers, the ASC model originally developed in 1970. By 1982, CMS or Medicare had approved around 200 procedures to be done in surgery centers. My specific surgery center was founded in 1985, so it was right around the time that a lot of this original development was going on. Today, there are over 3,800 procedures that are approved for the ASC setting by Medicare. However, the commercial payers are constantly expanding those boundaries and adding more approved procedures to their specific list. So commercial payers definitely are above the 3,800 procedures. More than 80% of surgeries are now done in an outpatient setting, whether that be ASC or HOPD, and they do not require overnight stays. The continued growth of surgery centers and outpatient surgical services in general continue to occur. CMS continues to approve more and more procedures every year. The last few years have specifically been focused on total joints and spine procedures. And if we look back 15 to 20 years ago, there are many that would have said that these types of procedures would have never been done in an outpatient setting. So if we ask ourselves, why do we continue to see growth in the ASC market? It's all really focused around quality of care that ASCs can give. There are advances in medical technology, techniques, and pain control that allow more complex cases to be performed in an outpatient setting. Surgeries are safer and patients are more comfortable, and the need for overnight hospital stays have reduced significantly. Patient selection is also a key to the success of surgery centers. Many common surgeries are performed as outpatient procedures, and most patients, except those with complicated health conditions, can be served in the outpatient setting. Having good patient selection criteria in place ensures that patients are receiving the most appropriate care in the best possible setting. The other thing to really keep in mind is that surgery centers are highly regulated. They have to meet extensive state and federal requirements and are reviewed regularly to ensure safety and quality are met at all times. Within my particular surgery center, it is state licensed, it's CMS approved, and it's also accredited. So we have to follow a lot of regulations. We're subject to a lot of surveys to maintain those credentials. So it's very similar to that of what you would see in a hospital. So if we kind of just take an overview of ASCs by state, just to kind of get an idea of how many surgery centers are out there. There's an image here that shows what the breakdown is by state of how many surgery centers there are. And there are a little over 5,600 Medicare certified ASCs in the country. Or in the United States. And then that equates to about more than 17,000 operating rooms that are dedicated to surgery centers. And if we look at that a little bit further and look at the specialties that are being done in surgery centers, there's either going to be single specialty or multi-specialty. And you can see that it's pretty much a 50-50 split. A lot of the common procedures that you're going to see done in a surgery center are listed here on the side. And multi-specialty surgery centers can range from 2 or 3 of these to almost all of them. Some of the most common single specialty ASCs that you'll likely see are ophthalmology, endoscopy, and orthopedic and pain are kind of put together a little bit. But these are the common procedures or specialties that are done in those centers. Okay, so let's dive a little bit more into why a patient would opt for an ASC setting over that of an HOPD, a hospital-owned facility. And these are also some of the same reasons why physicians choose to operate within an ASC. Quality is similar between an HOPD and an ASC. Patient outcomes are the same between the two. And while ASC staff are considered more specialized in surgery, the staff working in an HOPD should be similar as far as patient care goes. So the biggest differentiator between the two is cost. Medicare currently reimburses surgery centers 53% less than what they do in an HOPD for the exact same procedure. There's an annual savings that's created by patients currently when they choose to use an ASC that equates to about $40.3 billion a year. And if we break that down a little bit, $2.3 billion is within CMS, and then 38 is with commercial plans. And then even further, if we take a look at those commercial plans, more than $5 billion of that $38 billion cost reduction accrues directly to the patient through lower deductibles and coinsurance payments. So if we were to push more procedures and redirected them to surgery centers, there's a recent study that shows that we could potentially save an additional $55 billion a year if a lot of the procedures that are being done in an HOPD were redirected to surgery centers. So there's a great tool that was published by CMS a year or so ago, and I've got the link here. And what this tool does is it allows the consumer to compare the price of a procedure at a national level within an HOPD and compare that to a surgery center. So what I did for comparison purposes is I took 4 very common surgery center procedures, I plugged them into this tool, and we can go through those procedures just quickly to kind of give you an overview of exactly what I'm talking about as far as the cost disparity. So the first one we're going to look at is a removal of gallbladder with x-ray. So if anybody's had a lap chole, you can relate to this. So here we will take a look at the physician's fee in an ASC versus that of an HOPD, and it's similar. We take a look at the facility fee, and this is where you can see the big difference. And here we have the total cost, so the doctors plus the facilities fees. This is what Medicare will be paying the facility for each of those within each of these facilities. And then this is the patient's portion. So you can see how huge of a difference this is for the patient. The next procedure is removal of tonsils. And then just to remind people, these rates are Medicare, so this is not looking at commercial payers. That's a little bit harder to compare based off of facility type and geographic location. So we're just strictly looking at Medicare rate comparisons. But for removal of tonsils, again, we have the doctor's fee, your facility fee, total cost, and then right here again we have the patient's portion, estimated patient cost for an ASC versus that of an HOPD. The next slide here is cataract removal, which is probably one of the largest growing procedures in surgery centers right now. And again, you can see the comparison there between the facility fees and then all the way down to the patient's portion for each of those outpatient settings. And then the last one we're going to look at is a knee arthroscopy. And again, you can see where the difference lies between the ASC and the HOPD and the patient's responsibility right here. So the big question we ask ourselves is, why is there a disparity in cost? The biggest thing is that ASCs, we just have less negotiating power with commercial carriers. When you're trying to negotiate a contracted rate, it's hard to do that when you are looking at competing with a hospital. When the hospitals negotiate, they can use exclusive service lines, they can use their emergency services and other programs that are specific to a hospital setting to help leverage a higher reimbursement. Whereas in an ASC, we're only negotiating for strictly outpatient surgical services and sometimes even one specialty. So you can imagine if you're a single specialty ophthalmology center trying to negotiate a higher reimbursement rate when that's all you have to work with. And payers don't often understand the difference between an HOPD and an ASC setting. So it's very difficult to educate the payers on the differences and why surgery centers should be reimbursed more. So with all that being said, knowing that surgery centers are paid quite a bit less, are ASCs sustainable in this market? And the answer is yes, they can be. ASCs can remain sustainable with the disparity, but it just becomes more and more difficult year over year. ASC staff and supply costs continue to increase at a higher rate than we can negotiate commercial contracts for. However, we continue to make good progress with CMS and some of the commercial payers by bringing these issues to the table and trying to educate them on the reimbursement disparities and trying to close that gap. So with all that being said, ASCs are highly specialized and we continue to be highly specialized. ASCs are extremely efficient, which results in cost effectiveness. We have the ability to run a more efficient process than that of an HOPD, and this is due largely to the ASC's focus on a very limited number of procedures and specialties. We have a very unique owner-operator culture, and we do have highly specialized nursing and support staff. We just don't have the choice to not be efficient. So because of this efficiency and specialization, ASCs are able to deliver very patient care-centered services efficiently and conveniently. Operating room turnovers are very quick, which allows physicians to do more procedures in a timely manner, making them more productive, which does increase the physician satisfaction. That also allows a surgery center to bill for more cases in an 8-hour time frame than that of an HOPD. ASCs are also more convenient and cost-effective for patients, as we just reviewed. So that does help increase our patient satisfaction, knowing that we are providing excellent care at a significantly reduced price to the patient. So what is our expected growth for ASCs? There is still a great need for them. Baby boomers. This is one of the fastest growing populations right now. They say that right now 15% of the US population is age 65 or older, and those are typically the patients that are needing surgical care. It's expected to grow to 24% of the overall population by 2060. And ASCs can have a huge impact on the cost of healthcare spending in our country. As more and more procedures are approved by CMS to be done in the ASC, we will continue to see more procedures transition to the ASC setting, but we need the reimbursement of the procedures to be sustainable. So in summary, healthcare spending costs can continue to decrease for payers and consumers without compromising quality through innovative plan design and increased consumer awareness. Just imagine that if the most efficient site of service for outpatient services was utilized when possible, just imagine what the cost savings could be captured within the healthcare industry. And I felt like I got through that really fast, much faster than I was planning on it. There's my contact information if anybody has any more specific questions that they have that don't get answered. But Heather, I'd like to kind of put it back to you to see if there are any questions to go through.
Jamie, that was fantastic. I love that you compared the prices for different surgeries. That's really helpful. I don't think a lot of people understand that price difference really affects them and they're out of pocket.
Right. Yep.
The thing that I can point to specifically on the commercial side is that if someone looks at their summary of benefits, typically the commercial insurance company will pay more in coinsurance and more towards that procedure when it's done at an ASC.
Right.
So not only is the base price going to be less, but the insurance company is willing to take on more of the cost for that for them.
Right.
That's a big deal for a patient. So you gave us really thorough, fantastic information. I'm impressed. I didn't come up with any questions and I don't see any in the Q&A box, although if somebody has one, please type them in. And you will send out a copy of the slides later and it's got a link so that they can go look up those prices to see the difference.
Absolutely. And the tool is very user-friendly. I mean, you don't need to know medical terminology to find a procedure. You could type in hernia and it's going to give you a list of different types of hernias. So you can really drill it down specifically to what it is that you're looking for. And granted, it's not going to give you your commercial insurance rates, but it just gives you a general idea of what you would be expecting to pay and what that difference is. I'm sorry, one thing that I always tell patients too is, and for employers as well, is that when you've got somebody who needs to have a surgical procedure, ask your surgeon where they operate at. Push them, do you operate in an HOPD or an ASC? And if they don't operate in an ASC, ask them why, ask them if they have that option. So it's definitely a consumer-driven market nowadays, more so than it ever used to be. So you do have options and choices for sure.
Well, and not only are they going to get great care, but that's a big difference if they could do it here versus going, in Paulsbo versus going to Seattle. That's a lot for the patient, not only just in the time and the effort and the hassle to do it, but being able to go in, get it done quickly, be home and recuperating and not dealing with planes, trains, and automobiles to get home.
Right.
Well, thank you again for joining us today, Jamie. I appreciate that you were able to do this for us.
Yeah, not a problem.
Thank you so much, everybody. Have a great weekend.